Good morning everyone. My topic is role of specular microscopy in toxic endotheliitis due to latex of Calotropis procera. I have no I have no financial interest. So Calotropis procera is a flowering shrub which is commonly used to worship Lord Shiva, which profusely exudes out thick milky latex on plucking its flower. Accidental eye contact with its latex induces endothelial inflammation leading to variation of endothelial parameters. Specular microscopy is a non-invasive tool to assess the corneal endothelium characteristics. Documenting the endothelial changes in these patients is crucial, as if not treated on time may cause significant ocular morbidity. My aim is to study the endothelial changes in patients with toxic endotheliitis caused by Calotropis latex using specular microscopy. This is a prospective observational study for a period of 6 months. A series of 15 patients were taken with history of Calotropis latex exposure and diminution of vision. They were clinically examined as per standard procedure, and specular microscopy was done on day 1, day 7, 1 month and 3 months. Parameters assessed were endothelial cell density, hexagonality, coefficient of variation, and central corneal thickness. My first case was a 33-year-old female who presented with redness of right eye, photophobia, and diminution of vision. On presentation, visual acuity in right eye was 6 by 60 and slit lamp revealed mild conjunctival congestion with corneal edema with descending membrane folds. IOP in both eyes were normal. On treatment with topical steroids, visual acuity improved to 6 by 6 in 2 days. This is the day 1 specular microscopy finding. As we can see that none of the parameters could be assessed except CCT, which was found to be raised in comparison to normal eye. On follow-up, the cell count was found to be in normal range, whereas the other parameters revealed polymegathism and pleomorphism. As we can see on day 30, there was no reduction in endothelial cell count. Coming to case 2, 66-year-old male, known hypertensive, presented with redness of right eye with painless diminution of vision. His best corrected visual acuity was counting finger 1 meter in right eye and 624 in left eye. Slit lamp examination showed right eye seen to have conjunctival congestion and no epithelial defect, corneal edema with descending membrane folds. Nucleus sclerosis of the lens and hazy view of the fundus was seen in both eyes. IOP was normal in both eyes. This is the day 1 presentation when descending membrane folds were seen, and this is the post-treatment with 1 week steroid treatment. On day 1 of specular microscopy, the CCT was found to be raised in comparison to normal fellow eye. On follow-up, the cell count was seen to be within normal range after 1 week of treatment with steroids. The other parameters revealed some degree of pleomorphism and polymegathism, and after 3 months of follow-up, the cell density was not reduced. 15 such cases were examined. And this is the demographic profile of all my patients. 60% females were affected, 40% male. Right eye was more affected than the left eye. This is the clinical profile. Visual acuity was 27% less than 6 by 60 and 53% in 6 by 60 to 6 by 18 vision, and 20% patients had a vision of 6 by 18 to 6 by 12. My specular microscopy parameters, the cell density after 1 week of treatment was found to be more than 2000 in all cases after 7 days, and there was polymegathism and pleomorphism seen in all cases. Post-exposure corneal thickness on day 1, 20% cases had a range of 500 to 600, 60% case had a CCT range of 600 to 700, and 20% cases had a range of more than 700. After 3 months of follow-up and 1 week of steroid treatment, 73.4% cases had a CCT range of 500 to 600. So, all my patients were age ranging from 33 to 78 years presented within 24 hours of exposure. Females were more affected as against male preponderance. In other study, right eye was more affected. There were absence of pain, and all patients had stromal edema with descending membrane folds. My study, in comparison to other studies, Al-Mazin, he in his study presented that permanent endothelial loss was seen in specular microscopy after 3 months. Bassak revealed low endothelial count in 74 cases. Weckers revealed increased corneal thickness, low endothelial cell count, polymegathism and pleomorphism. But in my study, there was no significant difference in cell count. There was polymegathism and pleomorphism and increased CCT in 13% cases. So to conclude, specular microscopy is a valuable non-invasive tool for monitoring both qualitative and quantitative endothelial changes in toxic endotheliitis. Clinico-specular correlation helps in making an accurate diagnosis of the condition, assessing the functional reserve of the cornea, and prognosticate the disease. These are my references. Thank you.
Just one question. Do you think the amount of latex will, the outcome of your study will change?
Amount of latex?
Latex, what is going into the eye?
The thing is that the latex, all my patients were actually females mostly and retired individuals who were plucking those flowers to worship God. So even a small amount, they said that when they have plucked and accidentally they had touched their eye, then this diminution of vision happened, which was so profound that they had to present. So amount of latex, I didn't inquire. There are other studies also on this topic.
So you are saying comparison between the other eye specular and the 3-month outcome is
Yes.
not significant.
No, because the other study showed that comparatively there were low endothelial counts
Compared to what?
compared to the normal eye, fellow eye. But in my case, because all the patient presented within 24 hours, so immediate intervention, immediate diagnosis, and also follow up with specular microscopy, I could assess that if a patient are aware of this, then they can easily get treated, and this significant ocular morbidity can be prevented.
No, I'm just asking statistical calculation. You said there was no significant difference in your specular counts
Yes.
at the end of the follow-up.
Yes.
That was between the normal eye and
Yes,
this
yes,
eye.
yes.